This was a study measuring the effects of forehead rejuvenation on the hairline. It was a retrospective study of 31 patients. 17 of them had endoscopic surgery, and 14 of them had open pretracheal incisions. Early results were studied at 1 year, and then later results were studied at 8 years in follow-up. They measured hairline recession of these surgical groups versus age-matched controls, I think making it a strong study. The methods of their analysis seemed to be appropriate, their surgical measurements seemed to be appropriate, as did their photographic analysis. So what they found was that the open pretracheal group was the only group where there was a stable hairline. However, the hairline recession occurred both in the control group and also in those undergoing endoscopic surgery. Overall, I thought this was a terrific study, and certainly hairline recession is something that our patients really are concerned about, both females and males. I think it's helpful for all of us to have the information from this study, which I think is the first of its kind, to us for us to be able to share this with our patients. There were several concerns. Number one, it was a small sample size, but even with it being a small sample size, they did find there was a statistical significantly difference between the endoscopic and the control group that did exhibit the hairline recession over time versus the pretracheal open incision group where the hairline proved to be stable. The second concern is greater than the first, in that it is a group of only females, when it seems to be the males in my practice who express even a greater concern for hairline recession. Although the females do as well, the males seem to be particularly concerned about this when we're doing forehead rejuvenation, especially with males oftentimes having male pattern baldness or issues with it at the time when they're candidates for forehead rejuvenation. There still seem to be several questions, and that's, why does the open pretracheal incision cause cessation of hairline loss? And that's a question that wasn't able to be answered, I think, by this study, although they do have some interesting insights about why they think that might be. Secondly, the senior author observed that the density of the hair was preserved in patients that had the pretracheal incisions, and also why that would be the case still doesn't seem to be answered by that article. However, it does seem to be a terrific study. I congratulate the authors for doing this. It provides helpful information for all of us to be able to share with our patients, and it also provides us with some interesting questions that we all need to answer. Thank you very much. And another concern is why I would be asked to present an article about hairline recession.